I'm Laura Kavanagh. A little bit about my background. I was a very young, years ago, manager and supervisor, and I felt acutely the need to develop myself. I read voraciously about supervision in particular, and I fortunately had several mentors who were wonderful. I had Rochelle Mayer as my boss, who gave me great opportunities to grow, and in particular nominated me to be on the board of Healthy Mothers, Healthy Babies. So I was surrounded by public health leaders who also were very welcoming and sharing their time. I appreciated that. I had another mentor, Father Baumiller, actually, within the National Center, who was a Jesuit priest, who taught me about entrepreneurship within a university environment, very important lesson. And Vince Hutchins, I think, had the most lasting impression on me as a mentor. His door was always open, and he allowed us to grow together in everything from policy issues that we were struggling with at the time to he was very knowledgeable about the history of maternal and child health and taught me that area as well. So I felt my need to give back to the field is based on the generosity of so many people before me.
I would like to add a few thoughts to what we have heard. I'm Kay Edwards, and I have been very fortunate also to have had some very fine mentors over time. And the people who have mentored me have been within the field of public health and also without. I'm thinking of Jeanette Vroom, who was a public health leader from Michigan, and Lynn Benvager, who was a public health leader in Baltimore City, and Mary Aholt, who was a leader among women in the Business and Professional Women's Federation. These people have helped me. They taught me informally and formally while I was growing through my public health career. And I want to give them due credit, but at the same time I want to say to all of those women that I have not done as well as they have done in some ways, and I am still striving. I think that it is a continuing development, working with the self or working with others, and I wish so much that I had earlier put into practice so many of the fine things that mentors exposed me to. And I'm catching up fast, I think, but there is so much to do and there is so much growing to be done. And so to their credit, and some, I guess, a little bit to my own, it's a forward movement and it's evolutionary.
I think that career trajectories are always fun to talk about because I don't know how many actually follow the trajectory they set out with. I mean, I started my career as a sociologist, as thinking I was going to teach sociology, and got introduced to public health through serendipity and through interest in reading and kind of what was going on in the world at the time, and found a job doing research on HIV prevention, which then got me more interested in CDC's work and getting to know some folks at CDC and working with CDC, and then working with county health departments. And so through just kind of twists and turns of career trajectories, got to meet a lot of great people. I think mentoring is obviously a huge part of one's career path and learning. But always in every organization I was in, feeling like for us to succeed, we had to spend some time thinking about how we all work together and having good people that agreed that was worth thinking about. So just through serendipity and professional networking, learning about association management, which I had no idea existed as a profession, and now I'm running an association. So it's really a kind of twists and turns, serendipity getting to where I am now and with the people that I'm with now.